Welcome to another Metro Health Talk session analyzing heart attack incident among youngsters. And for this, we have Dr. Sameer Gupta, interventional cardiologist, director of cardiac Cath labs, Metro Group of Hospital, New Delhi. Hello, doctor.
Hello.
My first question to you is India becoming heart attack capital of the world?
Every time we hear something about a celebrity or a popular person in the media having heart disease or having sudden cardiac death, heart disease suddenly comes in the forefront. India is one of the major heart disease is a major cause of morbidity and mortality in India, and 25% of all deaths in India happen because of cardiovascular diseases. So yes, heart disease is a major source of healthcare burden in the country.
Thank you, sir. Moving on to our next question. What are the causes of sudden deaths among youngsters?
So, there are many reasons why people die, young people die. It could be a whole host of causes, and heart disease definitely is right up there in one of the top risk factors or the top causes of deaths. When you talk about heart deaths in young people or cardiovascular diseases, they can die of stroke, they can die of heart attacks, which are two different forms of cardiovascular diseases. And if you talk about cardiovascular in this subset of patients, heart attack is something which is fairly common in this age group. About 80% of all sudden cardiac deaths happen because of heart attacks in the young people. 20% of them may be because of other causes like hereditary causes or genetic causes or cardiomyopathies or for that matter even electrophysiological abnormalities in these patients.
Thank you. Moving on to the next question. So, what makes people die suddenly, and why at such a time people are not able to reach hospital?
So, there are two different things. Let's address this question in a different way. Let's talk about what is the difference between a heart attack and sudden cardiac death. This is a question which has often come to us, and many patients ask us this question, and it's a point of confusion for many, for the common man. Now, a heart attack is a blockage in the artery of your heart. A blood clot which is formed in the artery of your heart all of a sudden causes a heart attack. Now, when you have heart attack, you may have symptoms of chest pain, shortness of breath, dizziness. Some people may even complain of acidity, really bad acid reflux. But it's compounded with some of the other symptoms I talked about. You may have excessive sweating. All of a sudden, you're sitting and you're sweating. So these are some of the symptoms that people have of heart attack. Sudden cardiac death is when all of a sudden your heart stops beating and you technically die. That is sudden cardiac death. Heart attack can cause sudden cardiac death. It can cause arrhythmias, where your heart starts beating in a funny manner. It beats in an irregular beat, or it may suddenly stop beating, and that causes sudden cardiac death. But sudden cardiac death by itself, a cardiac arrest for that matter, can be because of many other reasons apart from heart attack. So heart attack can cause sudden cardiac death and cardiac arrest, but cardiac arrest by itself can also be because of other things like electrolyte abnormalities, hereditary conditions, etc. So there are a heart attack can cause cardiac arrest, but cardiac arrest can be because of many reasons where your heart suddenly stops beating or it's not pumping effectively.
Well, thank you, sir. Moving on to the next question. So, what immediate actions we need to take during this heart attack incident, or what if we say a relative or someone known get a heart attack? So, what are the first line of action needs to be taken by us?
So once again, let's break this up into two parts. The first is what do you do when you have a heart attack? Now, you would not know you're having a heart attack, right? If you're having any of these symptoms, the chest pain, the shortness of breath all of a sudden, the perspiration, etc. So you won't know what it is, because so it's important that at that point of time you immediately go to a hospital and get an ECG done. An ECG is of paramount importance in diagnosing a heart attack. Now, if you have a sudden cardiac arrest, that means your heart suddenly stops beating or it's not beating effectively, and all of a sudden you've passed out. That time you need to start CPR, which is cardiopulmonary resuscitation, where you start pumping on the chest, give that person breaths to try and to support the body till recovery happens or till the person is able to get medical attention.
So, what will be the preventive measures for heart attacks?
So, a heart attack is because of many reasons. What happens in a heart attack? So, when somebody has a heart attack, it is because of a blood clot which is formed in the artery of your heart that does not allow the heart to get the adequate nutrition it needs. Now, there are various risk factors for heart disease and heart attacks. Some of the common risk factors are diabetes, which is high blood sugar, high blood pressure, which is hypertension, smoking, increased stress, family history of heart disease. There are some of the common risk factors that we hear about day to day. And trying to get your diabetes under control, get your blood pressure under control, eating a good nutritious diet which is less in fatty foods, high in vegetables, fruits. These are some of the things that you can do to prevent heart disease, to prevent heart attacks. This also along with exercise, reducing your stress levels, sleeping adequate number of hours a day, 7 to 8 hours of sleep. So these are some of the common things that you can do, simple things that you can do to improve your overall health and reduce your chances of having a heart attack. Of course, one thing I forgot to mention is you should quit smoking if you do smoke.
So much, sir. And moving on to our next question. So, is there any role of lifestyle-induced factors?
Absolutely. So I think lifestyle is something which is of paramount importance in leading a good, healthy life. See, health is not one thing. It's just not, I want to prevent myself from a heart attack. I want to just improve my health and lead a good quality of life and lead a healthy life. So lifestyle plays a very, very, very important role. A question patients often ask me is that, doctor, if I start a cholesterol medicine, is this something that I need to be on life? Do I need to take this for life? If I start a blood pressure medicine or a diabetes medicine for that matter, are these medicines that I will have to continue for the rest of my life? And the answer is no. A lot of patients, a lot of people out there who have some of these diseases are able to reverse them by doing the right health, by making the right diet and lifestyle choices. Once again, like exercising regularly, eating good food, fruits, vegetables, sleeping 7 to 8 hours a day, reducing your levels of stress, doing meditation. So you can reduce your risk factor profile and your chances of having heart disease and heart attacks dramatically by using a better quality of life and improving your diet and lifestyle choices you make.
Thank you, sir. And moving on to our next question, how other countries, especially countries like US, England, and how they are dealing with this issue?
So heart disease is a major cause of morbidity and mortality across the world. Whether it's the developing nations, whether it is developed nations like the US, UK, or some of the other Western world, and even in India for that matter, heart disease is of paramount importance as a primary cause of death in a majority of Indians. So I think a lot of awareness about heart disease, a lot of awareness about prevention of heart disease, about better diet and lifestyle choices, not smoking. These are things which have really come into the forefront across the world in the medical community and also in the general community that will help reduce the burden of this disease and help you lead a better and a longer life.
And so, is there any role of genetics and family history as well?
Absolutely. So genetics and family history are something which we see a lot of in India and even across the world in heart disease. So in fact, what we've seen is that Indians compared to the Western world, we get heart disease 10 years earlier than our Western counterparts. So when I was practicing in America, if the average age of heart disease and heart attacks was about 55 to 60, in India that number for average is reduced by 10 years. So I'm seeing a lot of heart disease in 40s, 50s, sometimes even in 30s. We see a lot of heart disease. So heart disease is definitely an epidemic across the world, and yeah.
Thank you so much, sir. Is there any take-home message you would like to give to our audience?
So, a lot of patients ask me, the doctor, what can I do to, to prevent my heart disease in the future? What can I do to, live a better life? And, the answer is very simple. If you do have any of the risk factors we talked about, diabetes, blood pressure, cholesterol, if you smoke, if you have a very, very high stress environment, then try and improve your quality of life. Start making all the right diet and lifestyle choices. Improve your ability to improve your exercise capacity slowly and steadily. Eat good food, exercise regularly, get good sleep, incorporate meditation in your life. So these are good things that will not only help reduce your risk of heart disease and the burden of heart disease in you, but will also help you just lead a general healthy life.
Thank you so much, sir. That was the last question. And thank you once again for joining us today. And thank you, audience, as well.